how to submit to bill. Once you've completed your entire SOAP, your reason for visit, your review systems, physical exam, assessment and plan and orders, the last thing you need to do after you finish your visit is finalize your visit or charge for your visit. You can get to the code submission template by going to EM coding, which is at the bottom of your SOAP. That's one location where you can find it. Or you can go all the way to the top and click on finalize. The other place you can go is your navigation bar, and you'll find finalize right here. So we'll click finalize. What's important in the finalize template is really where it says provider sign off and evaluation management coding. All the other fields, once again, remember you can toggle. So that closes all the fields. Or you can expand them. If you expand them, there's just too much information. So it's better to just close it and open. If you do need to do a provider sign off, open that. And if you do need to, well, most importantly, what you need to do is the evaluation and management coding. Let me unclick these. Because everyone has a different style and the system is very particular about how it calculates its codes, I do not have you calculate the code. The only time that I have you calculate the code is if it's a preventative exam and the patient is insured. If the patient's insured, then you go ahead and calculate the code. If it's a CHCP, again, you go ahead and calculate the code. And the way you do that is click calculate code, and it will submit the appropriate preventative exam or preventative care code, which are difficult to kind of memorize according to the patient's information. So again, you only calculate code when you're seeing an insured patient and you're doing a preventative exam or you are doing a CHDP. Otherwise, you will select the code manually. If you use this, it doesn't really help you simply because even if you select this, if you have not selected enough bullet points inside your SOAP, so some people like to type out everything. When you type out everything, you do not select any of the buttons that are available on the templates. And when you don't select that, it will tell you that your code isn't sufficient. So to avoid that happening, because regardless of you, well, if you do hand type information, you are putting the information. Your visit is still viable and you should charge based on what you perform and what you do. So it's better to just manually select your code. Of course, it's going to be either an established patient or a new patient. The 99211 code and the 99201 code are nurses' visits, so you will never use those. You essentially will use 99212 or 99202 and above. The 99212 is a straightforward visit. Maybe you just looked at one system or did one review of systems, or you just discuss something with the patient. 99213 is already a more established patient. Maybe you've examined 2 to 3 systems. The 99214, or any code ending with the 4, is basically a visit that you've done more than 3 systems, possibly spend an extended amount of time with the patient, maybe counseling or whatever. If you do that, you can click on this counseling component document how much time you spent discussing something. Oops. Okay, the reason it's saying this is because you have to go into counseling details and document what you canceled. Maybe it took you a very long time to cancel the advance directive. You say that it was a verbal explanation. Maybe, the patient accepted the materials. You'll put in the time that you did spend. Save and close, and then indicate that that's also the time that you put. So then this will correspond with your visit, okay? A 99215, again, is for even a more extensive exam. Usually this is used for a sports physical because you do multiple components, but it's not considered a preventative exam code. And also you utilize this code if you do physical and the patient is not insured. So clearly you're doing at least examining 5 systems or more. You're asking multiple questions. So these codes are for those physicals that are uninsured, for uninsured patients. So once you understood your visit and you have decided what you have rendered, go ahead and select it and submit to code. You'll notice that when you do submit to code, it will automatically launch your note. So you'll wait for the note to generate. This is your note. You are welcome to review it. If you feel like you did input everything, you can go ahead and sign it by clicking on this check off. If for some reason you feel like you want to add more to this note later on, if you don't check it off, what happens is that it goes to your PAQ. Your PAQ is like a holding tank for notes that need to be signed and maybe notes that you need to get back to. But if you feel you're done with your visit and all your information's in that note, go ahead and click accept or that check off, and you will electronically sign your visit. But if for some reason later on you want to add more information, leave it unchecked off, and you will be in your PAQ if you need to review it and maybe add information. Or you can task yourself a little note, finish note, click OK. Click OK again. It's going to ask you to add to your to-do list. Say yes. And now it's in your inbox to finish your note. Either way is fine. Okay. The provider sign off. If you are a PA and you require your 5% to be signed off, you click submit to supervising physician, task your supervising physician. In my case, it's Dr. Noya. Click OK. I'm not going to send it to him because I don't think he wants to receive this right now. but you task it to your provider so they know that they need to review your note and sign off on it. Nurses, so the LVNs, RNs, they may do nurses visits and possibly they consult with you. So they too will do this. If you receive one of those, then you will go ahead and click I review and agree with the diagnosis if you're signing off on their note. Also, you'll be signing off on vaccines from MAs. So the MAs will also send you this. So when you get this in your task, you will see that it says submit to supervising physician for review. And then you will then select I have reviewed and agreed with the diagnosis and treatment plan. And you need to regenerate this note to attach that new phrase. In order to regenerate that note, you're going to go into this navigation bar, which I just went into. And click preview. It will regenerate a new note. And it will attach the phrase at the bottom. So now I'm going to sign it off. That the encounter was submitted to review. Usually it'll say the MA or the RN's or LVN's name. In this case, because it was me doing both, it has my name on it. And then it'll put the phrase that visit details were reviewed and approved, and it'll put your name. So that completes how to finalize your visit for a basic visit. Not this did not demonstrate how to complete or calculate a visit if you have a physical. Thank you.